Cast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. This is Holly Master, the Program Coordinator of the Colorado MESA Initiative. Welcome to today's webinar on Internet-based PECOS. We'll just go through some housekeeping items before we get started today. Just want to remind you that your control panel is how you create your experience for the webinar here today. If it's in your way, you can minimize it with the little orange arrow, or you can move it around your screen. You can also make your, by using your web browser screen, you can make your appearance of this webinar larger or smaller, or move it around your screen to your convenience. There is an ability to call in on the number that you see on the screen here if you're having trouble with your audio for any reason, or if you don't have speakers on your computer. Just use the phone number that's on the screen here or that's in your email that you received, along with the access code and the audio pin from your email. Right now I'm going to ask, if you hear us, if you could raise your hand. Use the little hand icon on your GoToWebinar and let us know. Thank you very much. Looks like we're coming through loud and clear. Everyone's muted right now. But you can type in any questions that you might have in the question box of your control panel throughout the webinar, and we will address all your questions at the end. The handouts for this webinar are available right now on our website, coloradomesa.org. You'll need to sign in and then go to the events section and upcoming webinars, and you will see the handouts posted there. By Monday, we'll have the archive of this webinar posted on the website. At that time, you'll be able to find it under the classroom section and the webinar archives. Would like to remind you that the Colorado MESA Initiative is a grant-funded program. It's a collaboration between Senior Care of Colorado and the Alzheimer's Association Colorado chapter. We are funded by grants from the Colorado Health Foundation, the Kaiser Permanente Foundation, and Caring for Colorado. Today our speaker is Shelly Thomas, CPC, who is one of the, I believe, foremost Medicare experts in the country. She always blushes when I say that. Shelly has been instrumental in running the billing office for the Senior Care of Colorado practice with 60-plus providers in 6 outpatient clinics and almost 300 facilities around the Denver metro area. So she's been in the trenches and she knows how things work. So she's here to talk to you all today about PECOS. And Shelly, I'll hand it over to you.
Thank you, Holly. Happy Friday to everybody. Thank you for joining us. I'll try to make this a little exciting. When we're talking about provider enrollment, it can be a little bit boring. But let's go ahead and start with our Medicare enrollment. There's actually 2 ways you can enroll in Medicare currently. You can use the internet-based PECOS system, which is going to be the focus of today's talk, and then of course there's the traditional paper enrollment application process that continues to thrive. So moving along here to the internet-based PECOS, for those of you that don't know what it stands for, it's Provider Enrollment Chain and Ownership System, known as PECOS or PECOS, depending on where you're from.
How you pronounce it.
Yeah. So I say PECOS.
I say PECOS.
Yeah, and we're both from Colorado,
yeah.
So that's interesting. So it is an internet-based provider enrollment program, and it allows a provider to enroll in Medicare, view their enrollment data, and update their enrollment information electronically. Trailblazer Provider Enrollment encourages providers to use this system because it does expedite your enrollment. There are 5 basic enrollment actions in PECOS that you can do through the internet. The first one is to establish a new initial enrollment record. That occurs if you're a newly enrolling provider or you do not have an existing record in PECOS. You can make a change of information to an existing enrollment record. So this occurs once you're already in PECOS. You would be able to edit information as you are needing to. The third is that you can add or change a reassignment of benefits. So this could be if you're adding or changing an existing reassignment, or you have a new provider coming on that you want to attach to your tax ID number. And we'll go through some further details as we go along here. And you can do a reactivation through PECOS, and you can do a voluntary withdrawal and that would be unusual. That would be actually if you were withdrawing from the Medicare program, but you can actually do that through PECOS. So the 3 steps to start to get an individual provider enrollment in PECOS is that you must have an active NPI number and an active NPPES number, and for the billers that are listening, you'll know what that is. If you don't have those numbers or you need to obtain those, I have some information in smaller print right there that will take you to a website to help you obtain those numbers. Those are required to enroll in PECOS, and of course you must have an NPI number to bill any payer today. So that's your first step, is to gather those 2 numbers. And then you're going to go to the internet-based PECOS website, as noted there, and you're going to submit the electronic application. Now, it sounds pretty simple. It's an application that's question-driven, and we'll talk about that a little bit further on the slides here. But the simple process is that you complete the application, and then you print, sign, and date a 2-page certification statement at the end of your enrollment application. And the certification statement is the most important item that you need to make sure get signed very quickly. Medicare will not begin processing your application until they receive that certified statement. So once you enroll electronically, you're going to print out 2 pages, you're going to sign those, and you're going to Federal Express those to Medicare for processing. So it's a requirement, and the contractor won't touch your application until they have that certification statement. Okay. There's 2 ways you can actually sign your enrollment application. They have an application where you can do an electronic signature or you can do paper. If you're going to do an electronic signature, there's another enrollment process that you have to go through. The ESignature obviously would save time and expedite the enrollment further, even more so than the paper certification. We currently as a practice are using the paper certification because we've just found that that's how we did it initially, and that's the way we've stayed, but it doesn't mean you can't do it electronically. If you're interested in doing the electronic signature, you can do that through the PECOS website. There's a tab for that, and you'll go through a process of answering some questions, and then you'll be sent an email that will ask who the signer is, and you'll have to authenticate your signature. And it's a one-time thing to do that, so if you have a lot of providers in your practice or you're going to bring on a lot, it might be worth your time to do that. And so that tab will walk you through enrolling in that program. The paper process is a little simpler, and it doesn't take the extra steps that the ESignature does. The certification statement must be printed, signed, and dated. The signatures must be original. We always do ours in blue ink so that they know it's original. Sometimes black pens look so similar to the copies that they don't buy that it's original. So blue ink is a recommendation. They don't allow a stamped signature. They will send it back to you if it's a stamped signature. So again, that's the only thing that you have to send into Medicare. Everything else is done electronically. And if you're with an organization that's a group of providers, so you have a group tax ID number and you want to add providers to that, they have a program, also part of PECOS, that you can name an authorized official. And this is a one-time registration where the individual would register through PECOS, and CMS would do the same verification on this individual that they would do any provider that is enrolling. Okay, and let me skip slide 16 and go to 17 to talk about who is an authorized official. This individual would be responsible for submitting provider applications on behalf of the practice. So if you have somebody that's currently completing your paper enrollment packets, this person may be the one that you name in your practice that would do that. And so this individual, once they're assigned as an AO, they would be able to assist the provider in completing their enrollment application online. And it's really a good idea if you're in a big group. We have 2 authorized officials in our program, and those 2 individuals, when we have a new provider come on board, they come to our office and we log them into PECOS, and we are side by side with them so that they can answer the questions right away, and then that authorized official is sending the application on their behalf. So if you have a person on your staff where they can babysit that, it helps the providers. If your providers are like ours, going even to a website is a little overwhelming to them at times, so having an expert in your office is a good idea. So this AO will go through a similar review and approval process. It takes about 2 weeks for that to get approved. The individual is going to complete a security consent form, and I want to say the application is 3 pages long, but it's a one-time paper-driven process, and once you're an AO, there is no renewal of that. And there's a security consent form at the end of the application that the help desk at PECOS can help you with if there's questions on that. The AO will also have the ability to log into PECOS periodically and look at any applications that may have been filed on behalf of that tax ID number or individual providers, so that you can respond to outstanding issues or make sure that your enrollment is moving ahead. So it's recommended that AO periodically log on. And the other reason it's a good idea to name an AO is that the provider that you're enrolling most likely won't be interested in logging into PECOS to check status. So because the staff is generally responsible to make sure that the practice can bill, it's really important to name someone to do that. And again, more than one person can be approved in your practice to do this. So maybe it's the office manager and your billing manager, or a combination of those 2. And again, once the registration and verification has been completed, you will get a letter from Internet-based PECOS letting you know that you're approved, and it can take several weeks to do this. So if you're thinking about using PECOS, I would do this step first, because it's going to take you a few weeks to get that done, and then you can start enrolling future providers in PECOS. You wouldn't want to wait a few weeks to start your enrollment if you've got a new provider starting next week if you haven't done this process. So using the internet-based PECOS, when you log on to PECOS, as we talked about earlier, you're going to go to the My Home and then My Enrollment page, and that can be found on their website, and it's pretty easy to navigate. And this is where you're going to initiate your enrollment. And as you open the enrollment application, it is a scenario-driven application. So it's going to present you a series of questions that will drive you down the right application. And again, what I have found when I'm working on this, if I have a question while I'm in there, I call their help desk, and they're more than helpful. Probably more helpful on PECOS today than they are doing the paper enrollment, because they really want everyone to be internet-based. So it is scenario-driven and pretty user-friendly. And so the internet-based PECOS enrollment page summarizes the task you're about to begin, and it confirms what you're doing. So there's lots of things that are going to flash to you to make sure that you're answering things right and that you're in the right box. So to complete each task, you simply enter the required information and navigate through the screens that are displayed. Once your internet-based PECOS application is submitted, it is locked and you cannot edit this application. And the only way that you would edit that is if Medicare returns the application and they're asking for you to make corrections. But on the initial submission, it's locked once you've sent it until CMS takes a look at it. So you may use Internet PECOS to check on the status of the enrollment application, typically not earlier than 15 days after you've submitted. They don't look at those applications sooner than 15 days because they have to get the certification statement, and then it is worked on a hierarchy of which certification came in first. So it's important to Federal Express that statement the day you're doing your application. And once you've submitted the application, there are 4 statuses that you may get a response for. You're going to get one that says it's received, and that just means that you successfully have submitted the enrollment application. And reviewed means that they are currently reviewing that application. Returned, obviously they're returning that application because they need additional information or there was a question. And it's really important to act on those right away. They do allow you to take 30 days to respond, but it really should be a priority to get those turned around quickly so that you can get your number assigned sooner. If you don't respond in a timely manner, they can close your application and they will deny it and reject it, and you would have to start over. So approved or rejected, that's pretty straightforward. At the end, you're either going to be approved or rejected. Most people are never rejected. They may change the timing of your enrollment if they've had to reprocess a lot or they've had to ask a lot of questions. So number 3 is the most important. They're returning requested information very timely. So through the process, you're going to get a system-generated email that will be sent to the contact listed on the application, and that may be the AO or it may be the individual provider. The email states the application status, and just a note, process can indicate that the application is approved, rejected, or returned. So process, isn't necessarily a gold star that says it's processing because they haven't actually made an action yet. So timely follow-up is the key. After your initial email is received, there are still steps that Trailblazer will initiate to enter the PTAN into the Medicare system. So these steps ensure the provider's newly assigned PTAN is active for billing purposes, and that generally takes 3 to 5 days after that approval has been made. So a confirmation will be mailed to the contact person, and you should not begin billing until you have that paperwork, because until you get that letter, the billing system is not set up for you to start electronically filing claims to Medicare. And just a reminder that you should mail back all of the required documents that they're asking for, making sure that you have an original signature. And Medicare contractors are mandated by CMS to reject any pending applications within 15 days of the application that was created. So if you haven't mailed that certification statement by the 15th day, or they have not received it by the 15th day, they will reject your application. And again, being timely there is a good point. There are some limitations in PECOS. One of the limitations where you would have to use the CMS paper 855 form, which if you're enrolling Medicare, you know what that is. If you are changing enrollment when the practice location is different, you're moving to a different state than the enrollment initially took place, you have to do a CMS 855 paper. If you've had a change in ownership, an acquisition, or merger, that would require paper. Changes in the TIN, tax ID number, changes in legal business name, or enrolled Medicare Part A, wanting to switch over to Part B, those are all going to require the traditional paper application process. And if you tried to enroll in PECOS, the question scenarios wouldn't probably let you move forward, but just keep in mind that if you're in any of those scenarios that you need to look to paper first.
Shelly, where could they find that form if they need it?
All of the enrollment applications are under the Trailblazer Health website under Provider Enrollment.
Thank you.
And so the processing time frames, they've actually published those, and they've actually made a point of doing that because, of course, PECOS is supposed to save us time. So for Internet PECOS, CMS requires the contractors to process 90% of the applications within 45 days. So that doesn't mean 100% of them will be processed within 45 days, but they have to do at least 90% of them. Now, that doesn't mean that all of them will take 45 days. We've actually had some approved within 29 and 32 days, so there are lucky times during the year where those days are fewer. And if you compare that to paper enrollment, the contractor is required to process 80% of applications within 60 days, and 80% of changes or reassignments within 45 days. So just if everything went right in the world on paper, it's still longer. But even on their paper assumptions here, rarely do they assign it on paper that quickly because there's typically something wrong. Somebody forgot to check a box or somebody forgot to date something, and you know that that'll come back. So, you know, they do make a point of also saying that they can adjust those time frames based on their own workload, increases and decreases in the number of applications that they're getting. So, you know, it's important to take a look at that timing. And people that are involved in your practice with enrollment, you know, you're only as good as your last enrollment, and if your days are taking longer, your billing office and your provider and your administration is generally knocking on your door wanting to know what's going on. So this is really a tool, honestly, that can help you speed up the process, and the tracking is much better than on paper. You're going to be assigned a tracking number, and you will have a better trail for follow-up on, you know, initial enrollments for making sure you get your Medicare number. So again, we're just revisiting the PECOS website. And then there are some other advantages of PECOS that we have noted here that we've just gone over. Sorry, we're having a little technical problem with the slides. And so the primary advantages to PECOS, and one of the reasons we decided to go this route, is that it reduces the time that it takes to enroll. It streamlines your Medicare enrollment, and it allows you to view your Medicare enrollment information. On the paper version, once you've submitted that paper, you don't actually see what's loaded in the Medicare system, but being in PECOS, what you see in PECOS is what Trailblazer Health has in their system. And it should reduce your administrative burden with completing and submitting paper. And I've listed some other resources here. Of course, you can always go to the Medicare enrollment site to get the paper applications that will guide you through the PECOS system. There's a help desk. It's called the CMS EUS Help Desk. And they are very, very helpful when you're completing the PECOS applications. And literally, the first time we did it, we spent a half an hour on the phone with them and walked through every question that was being asked, and they were more than helpful. Because the more people that they can get on PECOS, the more money it saves them. It's less time to process paper. So
it's to their advantage,
it's to their advantage as well.
Help you get this done too.
So I have found that they've just, you know, are willing to take the time initially if you make the outbound call to them. And, you know, PECOS is not a requirement. It's obviously a tool we can all use, but I can foresee down the road that Medicare will require you to use PECOS. And, you know, that said, when we started using PECOS back in 2009, and we used it when they first rolled it out, you know, just like with any electronic application, there's bumps from time to time electronically, but as long as you do your follow-up, anytime they ask you for something, and as long as you send back what they're requesting, typically those things get taken care of, and, you know, you'll get your Medicare number in the same time frame. So we encourage anybody we talk to use PECOS. The sooner you can bill, the better. And I hope that if you're not on PECOS, that you at least consider doing that. So at this time, I would like to ask if there's any questions or observations that we might be able to address.
You can feel free to type them in your question box in your control panel if there's anything you'd like to ask or comment on. And we'll give you a couple minutes to do that. While we do, I'm just going to move on and remind everybody that we've got a wealth of resources available to you on our website, coloradomesa.org. Of course, everything is funded and paid for by the foundations. There's no cost ever for you to access or use any of this information. Reminder that all of our webinars, which drill into one specific topic that we're not able to cover in great detail during our live workshops, are archived, and they're all available there on the website. There are some clinical topics as well as billing and coding related things that are really important for all practices to know. So please avail yourself of those resources. And we also have a discussion forum there. So if you have any questions about PECOS that were not answered today, that may come up as you get into the process, or actually anything you'd like to talk about related to Medicare, Shelly moderates that forum, and you can post a question there, and it will be replied to. Our next webinar is coming up on July 13th. It won't be the first Friday of July due to the July 4th holiday, where we'll be broadcasting a week later, as always at 12:15 p.m. And we have a really special guest speaker that we're excited about in July. Stephen Milgward is the outreach provider for Trailblazer Health. And we heard him speak at the Rural Health Center Forum a couple of months ago, and he was absolutely a wonderful treasure trove of information about billing issues, specifically for rural health centers. So he's going to be presenting the top 10 things Trailblazer wishes you knew. And that is sure to be a really helpful presentation by Stephen in July. So we hope you can join us. And there may be some things that would be generally useful. Primarily, this one is geared toward our RHC clinics. Okay, I see a question coming in here from Bella, and she asks, do you know about how many of the Colorado providers are currently enrolled?
You know, actually I don't. I can tell you with our practice there's 79. I actually wouldn't have those numbers. CMS might, Trailblazer Health might have something published about that.
Yeah, I wouldn't know either.
Yeah.
Okay, any other questions, folks? We want to thank you very much for your time and attention today, and have a wonderful June, and we hope to see you in a few weeks back here on our next webinar. Thanks very much.
Thank you.